It just changed the health insurance industry, instituted by President Obama, which is why it's called Obamacare by some. And so it did a few things. The first one was that it got rid of what was called pre-existing condition limits. So before the ACA or Obamacare, an insurance company could say, I am not willing to sell you insurance because you have a health problem or a disability, or in some cases, you're, you smoke, or you've had, there were cases of having been pregnant more than once, or currently being pregnant, being a pre existing condition that would, enable an insurance company to say, we're not going to sell you insurance. Um, so yeah, so Obamacare, or the ACA, made it illegal for insurance companies to deny you coverage based on your health. So now, regardless of your health status or disability status, you can, you too, can purchase health insurance. Um, and it often, so kind of along the same lines of pre-existing conditions, insurance companies could charge wildly different rates. So people who were gendered as men often had much lower rates that they had to pay for health insurance than people who were gendered as women. The reasoning on the part of insurance companies being that, oh, people with uteruses like have babies sometimes and that's expensive and we don't want to pay for it. So we're going to charge people with uteruses more money for their insurance policy. So now you can't do that. You can't have different rates for insurance based on gender or health status. Which leads us to the individual mandate. So if you're allowed to charge wildly different prices for different people, based on how much you think their health care is gonna cost, and you're allowed to exclude people um, based on the fact that they have a disability or a health condition, it's much cheaper for an insurance company to pay for the care of everyone in the pool. So, in other words, insurance works when we have either when people don't need much expensive care. So, the health insurance company is taking our money and not having to pay out much money because people need expensive surgeries. Or it works because they're collecting. So, it works really well for insurance companies when they collect a lot of money from healthy people and don't have many people who are sick and need care. Super profitable. However, if you take away being able to exclude people who are going to cost money to the insurance companies aren't making money, and they might also be at a deficit because if we're all paying in, if you have 100 people who are all paying in $50, um, and then one person needs a surgery that costs $500,000, the insurance company is screwed. So they either need people to pay more or you need more people paying in. So either all of us who are already, insured by this company start paying $500 or we get 5,000 people instead of, I lost track of the numbers here. We get more people. So the individual mandate is this idea that every single person in the United States either needs to be paying for health insurance or they have to pay a tax penalty. And so that way, more people are are paying into the insurance system. So that's another source of being able to afford, to pay for people who have high healthcare needs. So the individual mandate was kind of a compromise with the insurance companies who didn't want to lose their ability to make buttloads of money. Now everyone has to pay for insurance. And that's more, revenue, more income coming in for insurance companies. There were also, so that was kind of the biggest change under the Affordable Care Act. There's also what are called collective marketplaces. So, like Commonwealth Care in Massachusetts, you can buy sometimes, and this varies a lot state to state. You can buy health insurance through the state instead of through your employer, and based on your income, the state might help you pay part of the month, the costs that you owe. And some states were also given subsidies to expand Medicaid coverage to include more people. So Massachusetts was one of those states that took federal subsidies, and now it's easier to get mass health. So you can make a little bit more and still be able to get mass health. There's still a lot of people who can't get mass health because they make just a little bit too much. Um, the Obamacare, the Affordable Care Act, is not universal health care. Um, so it was a reform of health insurance, not moving to universal health care or a single payer system where the government pays for care and everyone can access it. So thank you for coming to my very long TED Talk.